Hello, my name is Ricardo Baptista Leite, and I am a medical doctor and a member of parliament here in the Portuguese National Parliament, and also the founder and president of the Unite Parliamentarians Network for Global Health, a constellation of current and former members of parliament, congresses, and senate from over 90 countries around the world, focusing on global health policies under the umbrella of the Sustainable Development Goals and in official partnership with the World Health Organization. It is with great pleasure that I am speaking to you as part of the FH Europe family, a patient network that I highly value. And I particularly am grateful to my dear friends Magdalena and Nicola for inviting me. I wish I could be with you in person. However, I already had previous commitments in the northern part of my country, but I'm certain that Lisbon will treat you fine in terms of its weather, the food, and certainly the discussions you will be having. And we will be in person together sooner than later, I am sure. I didn't want to miss this opportunity, though, to speak to you on a matter that is very close to my heart, which is on the importance of prevention. We know now more than ever that we need to lower the burden of disease within our communities, within our societies. If we fail to lower the number of people that are getting sick, that have diseases that could be prevented, that have diseases that can be cured, and keep people coming more and more to hospital and other clinical settings, we will reach a point of unsustainability that will lead our health systems to collapse. We need to shift the paradigm of these disease systems towards becoming systems that are capable of promoting health and well-being. The truth is, in most European health systems, we do have disease systems instead of well-being systems. And talking about FH in particular, it is so clear how we need to intervene earlier. Cardiovascular diseases are the main cause of death here in my country, as in many Western or richer countries around the world. And this has led to enormous, not only numbers of deaths, but also impairments and loss of quality of life that could have been avoided. And we have the knowledge and the scientific tools today to understand that we need to change the policies and the way we create incentives and the way we manage these issues within our health systems and within our governments at large. And looking specifically at the issue of FH, the issue of pediatric screening, which is so important, understanding that a simple blood test to check cholesterol levels can truly help save lives and ensure better quality of life down the line is something we haven't discussed enough, truly, even within the public health or the global health bubble. So it hasn't been certainly discussed enough in policy at large and within governments. And so there is a need to move forward. There are signs of hope out there, of course, when we look at what is happening with the European presidency under the flag of the Czech Republic, where we're seeing step-by-step approaches. And now there is hope that within the lower chamber of parliament, the Chamber of Deputies, there will be a possibility to move such a pediatric screening movement forward. And so the role of members of parliament being able to shape and change the landscape and the future of the population, doing so, basing themselves on scientific evidence, can be a true game changer to not only save lives, but improve the quality of life of all citizens. And therefore, coming from Portugal, being an active member of the public health community, a politician in my country, I believe that Portugal should also endorse the Czech Declaration and understand the importance of including these preventive approaches within our public health strategies. We know that for too long, public health has been put on a sidetrack when most of the funding has been going into reacting in the face of disease. Here is an opportunity to move towards a model where we focus on value, on what are we actually investing into towards bringing better health outcomes, better well-being outcomes to the populations that we as politicians serve. And so I leave you with this message that together, patient organizations, scientific representatives, representatives of governments and of the European institutions, and those that are elected to represent the people, the parliaments, we should all work closer together towards pushing forward policies that can serve the people. And I thank FH Europe because looking at the program of this networking event, you are trying to do exactly that. And so we stand together. And as we like to say at Unite, the challenges may be great, but we will overcome. It is time to unite. Thank you very much.